Today, the province took action to implement a number of new requirements aimed at limiting the spread of COVID-19. Many of the actions announced by the province are the result of its willingness to listen, its understanding of regional differences, and its collaboration, particularly with Mayor Tory and Councillor Cressy, Chair of the Board of Health, who have been tireless in their efforts on behalf of Toronto. As your medical officer of health, I am in agreement with the province's course of action. It has my full support. However, I am convinced there is more that must be done to protect Toronto against the dangerous extent of COVID-19 resurgence. The reason I am asking the province to undertake additional public health measures is to drive overall case counts down. When this happens, we will return to previous case and contact management strategies. We measure the infection rates using a 7-day moving average. On September the 1st, we averaged 40 new cases each day. On September 29th, the number was 236. These numbers won't reverse on their own. They won't reverse themselves. They will only increase without action. This is the threat we face, and this is why I am asking the province for support to do more. Quick action is needed now. I want to be clear about what it is that I propose and what I don't. What I propose is this. For restaurants and bars, I request the suspension of indoor service for a period of 4 weeks. 4 weeks represents an interruption of 2 incubation periods for the virus. These venues would still be able to continue outdoor, takeout, pickup, and delivery services. For athletic facilities, I request the suspension of indoor group fitness classes and indoor group recreation and team sports. The nature of these activities creates a real risk of virus spread, and we have seen exactly that in our community. Again, I propose this suspension for a pilot period of 4 weeks. For large venues like banquet halls, I propose a requirement that they submit a plan to Toronto Public Health demonstrating how they will comply with public health measures such as capacity limits, seating to assure physical distance, and the method for collection of contact information to facilitate the ability to reach those affected by an outbreak. Finally, I'm also recommending, as much as possible, that individuals only consider leaving their homes for essential activities such as work, education, and fitness, to name just a few. What I don't want is a return to a lockdown like we saw last spring. I do not believe that is necessary. My proposals are meant to prevent the conditions that would force a large-scale lockdown.
So to clarify, I did speak with Dr. de Villa. I did get her letter. She was certainly recommending those for her jurisdiction. She said to me, I can't speak on behalf of Peel or Ottawa or the rest. So she felt very firmly that because of the rapid rise in numbers within her jurisdiction, she was hoping for more even extensive measures to be taken. She felt she had the data that backed that up. With the restaurants and bars, as Dr. Hyers already noted, she's seen some in group activities in event centers such as gymnasiums. She's seen some in some other sports groups and that where we haven't seen the rest of the province. So that's one of our challenges, is that we don't see the same thing throughout the province. And so we have these hot zones at the moment where nearly 70 to 80% of the cases every day ramping up. Even Toronto today makes up half of all the cases, slightly more than half. So these are the ones that are most concerning. So we take her recommendations. She's brought them forward. She gives them, we ask for evidence and data on that. We'll get that. But that's what she would like for us to consider as far as for her jurisdiction, the City of Toronto. But she was clear when she spoke to me, she was not trying to apply that to other jurisdictions, as that would be up to their local medical officer of health and their local jurisdictions.